If you want to do well during your first week of residency, your knowledge isn't what's going to get you there. Becoming an effective intern is about becoming efficient and strategic. And I'm telling you this from my experience because I, on my first day of psychiatry residency, could barely list 2 antipsychotics. I remember my first time the attending asked me what antipsychotic I wanted to use, and I recommended risperidone. He said, "Oh, that's a good choice. Why?" And I said, "Honestly, sir, it's because that's the only one that I know." I also happen to know Haldol, but I didn't know the difference between the two of them, the difference between first and second gen antipsychotics, and I felt really insecure, and I talked to him about that, and he said, "Don't worry about it. You're gonna get all of that in context. Just focus on learning about each patient in front of you." The thing is, when you're an intern and you're so overwhelmed with all the work that you have to do, it's really hard to take the time to sit back a little bit and learn about the people that you're working with. So very quickly I realized that becoming an expert psychiatrist is not going to be about learning or memorizing things faster than anybody else. It's about being as strategic and efficient as possible in my workflow. So first thing, I arrive on the inpatient unit in the morning. I look at the overnight events. What has happened? I check the morning labs, I check vitals, I make sure that everyone's doing all right, and if they're not, I immediately place orders to respond to that. Whether that be further imaging, or if I need to reach out to the nursing team to learn a little bit more or give some guidance on what to do until we're able to round on the patients. I found efficient shorthand notations for how to note down what happened overnight, anything in the labs I need to think about, any med changes I need to think about. I made it a goal to get that morning chart check done for all of my patients within 15 minutes. That helped me not have to get there too early so that I could get all my work done, but I also could get my sleep. Once I did that, I would immediately want to go round. Depending on the unit I was working on, I might have to go to a team meeting before that or during that or after that. But otherwise, the next priority is going to actually see the patients, do my clinical examination, and see what's going on for the day. Once I'm done with that, the priority is putting in any additional orders that need to happen, particularly consults, because those can be a rate-limiting step in care. That also means putting in any orders for updated medications or lab draws that need to get done that day so that you're not prolonging length of stay when those things don't get done on the day they need to get done. After that, write notes. It's taken me years to figure out how to write a really efficient, short note that captures all the meaningful information without adding obfuscating detail that makes the note less useful to anyone reading it. The goal is thorough enough and as concise as possible. Your literary award-winning notes don't make your patient's life that much better. They just need to capture the important information as concisely as possible and give you the rest of your time back so you can actually learn to be a better psychiatrist and go spend more time with your patients. So don't push too hard trying to learn all of the content before your first day of residency. Just try to get into the mindset of learning an efficient system. Please comment whatever questions you have about your first day of residency, and I'll use that as inspiration for some of my upcoming videos.